PD or Palmar digital nerve block. The Palmar digital nerve block is basic or the landmark for that. So the Palmar digital nerve block will be done over. The Palmar digital nerve block. The Palmar digital nerve block will be done at the levels of the bones of the heel. The bones of the heel. And as you can see here, this is the bone of the heel, and this is the other bone of the heel. And when you press, because it's cartilaginous, you will feel that it's like a depression, like you're going through a joint capsule, like you're doing some mattress, some soft tissue underneath you. Okay? So what you need to do is, the very first thing is zoom on this here. Yeah. So you see, this is the clouds of the heel right here. Can you see that? You saw them, right? Okay. When you feel that area over the bulbs, we will feel them also on the living board. You will feel that they are soft and they are cartilaginous. The end of a cartilaginous material there. Okay, this is the landmark for doing a Palmar digital nerve block. I say a Palmar digital nerve block. I don't say a Palmar digital nerve block and the dorsal branches. The reason why is because the dorsal branches are not here yet. Okay, the dorsal branches are above, a little bit above that. We'll do that with the abaxial. Now, let's go back to the Palmar digital. What you need to be doing is you need first to feel the bundle between the bundle that consists of a artery, vein, and nerve. An artery, vein, and nerve. And in this cadaver, you will see it better. Okay? Like this dissection right here. Zoom on this area, please. Hold this up. Thank you. This is the bundle of the that contains the artery, vein, and nerve. All three of them. Can you see these? All three of them? Yes. 1, 2, and 3. The artery, vein, and nerve. Can you see those?
Yes.
Okay, or these? Okay, so this is the bundle that you actually need to feel. You need to see it on the cadaver, and you need to feel it on what? On the live horse. See it on the cadaver, feel it on the live horse. You have to feel it under your thumb. See how it's rolling under the bulbs of the heel? It ends up right here. So you roll it to the side, you move it to the side with your thumb in the live horse. You give the injection, okay? You give the injection, and after you give the injection, you let go with the bundle. And so when you do that, the bundle does what? Goes back to the area where you have what? A pool of anesthesia, right? So this is the Palmar digital nerve block, PD nerve block, above the bulbs of the heel, above the bulbs of the heel. And this is where you need to give the injection, right here, and also you give it right here. Okay, so you have two areas of injection. And this nerve block basically blocks what? Blocks the caudal third of T3. Caudal third of T3. Caudal third means this third right here. Okay? This third. Okay? So it does not cover the whole T3. It does not cover the whole coffin joint. It does not cover the whole hoof. It only covers what? The 1/3. The caudal 1/3. This is a key word. Caudal. 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 And please remember that. And do not come cry in the test, oh, I said the distal 1/3. I don't care what you say. I say exactly these words, and I want them to be remembered exactly the way I said them. Okay? Caudal 1/3. Caudal 1/3. Okay, this is the caudal 1/3 right here. Okay? And this is a diagnostic test mostly for what? For navicular disease, because this area is basically where the navicular bone is sitting, okay? So if I have a horse that I have lameness in, and I blocked it with a PD nerve block, both medial and lateral. By the way, when you do the nerve block, you have to do both medial and lateral. You don't do one side and leave the other, okay? So when you do the both sides and you've eliminated the pain, which means the lameness, you've eliminated the pain 100%. What does that mean? That means your next step is going to be radiology, right? If you did not eliminate it 100%, that means what? That means you go higher, nerve block higher, which means that the next one after the TB, and this is in a chronological order, just like when you name the joints, you name them in a chronological order. You don't mix apples and oranges. When somebody asks you about your name, you don't say your father's name first, and then your middle name, and then your first name, and then your family name. It's your name, your father's name, and your family name. This is exactly the way joints and everything else needs to be named. The other thing that I would like to mention to you is the fact that when you treat the navicular disease, what are you going to treat them with? You're going to treat them with palmar digital neurectomy. Palmar digital neurectomy, cutting of that nerve. When you cut that nerve, it is extremely important not to confuse the nerve, with a structure that's very glossy and can be distinguished from the gum forceps, not a